background before she had the amputation?
Well, Lucy, I swore that, dogs just go to the vet once a year, right? They're cheap. And as a puppy, started having some lameness in her elbows, which I didn't recognize at the time. I didn't treat dogs then, but she used to bunny hop down the stairs. And later on, after realizing that her elbows were bad, I realized that it's easier and less painful for her to distribute the weight through both front feet than it is to go down, ow, ow, ow. So she goes, ow, ow, so she bunny hopped down the stairs, which is not normal for a dog to do that. So that's one clue of, oh, there might be something wrong. So she had elbow surgery for the fractured cornoid processes in her elbows. So that was her first thing. So she has, to this day, horrible arthritis in her elbows, and they don't bend past 90 degrees. So that was the start. She was also she had a mast cell tumor, which, as you know, when they first come up with those, they have to take really nice margins in order to make it cancer-free and clear of that tumor. And we did that. She survived that.
Where was the tumor?
In her armpit.
Wow.
Yeah, that's how we say, touch your dog everywhere. When you find things, ask somebody about it, because you just don't know what it could be. So she survived that, and then, I let her do all the things that most people let their dogs do. She ran at the dog park, she played with other dogs, she jumped on and off the bed and off the sofa, and, that's what she did. So she came up lame one time, or for a while she was limping on one leg, and I took her to the surgeon, and they're like, she has a cruciate tear, and this is the surgery that we do. And by the way, after we do that surgery, most dogs tear the other side, so you might be back. So she went through the first surgery, and then of course came up lame on the other side. And I don't know if that's because she was compensating so much for the bad leg while it was bad before she had surgery, that then she tore this leg, and then when she was getting around after surgery, she tore it all the way. I don't really, you don't know. And she had issues, and she's got neck pain and back pain, and just from being a 10-year-old Rottweiler. And so, in doing acupuncture for all those other issues, Dr. Oxford, who's one of the veterinarians here, had felt this little nodule on her that was just kind of right at her tibia. Got her x-rays, and the vet's like, I just see lysis in the bone that happens just from, having the TPLO and just being older and arthritis and this and that. And we accepted that for a couple weeks. And then Heather's like, I keep checking it in, it's getting a little bit more large, it's getting a little larger, and it's a little painful for her now. She's like, I would do something else. And by that time now, Lucy was you could just barely see her starting to off-weight that leg a little bit. So she was just shifting her weight a little bit. Not totally limping to where somebody would be like, red flag. Whereas normally, with the osteosarcomas, by the time we recognize them or diagnose them, it's because they've swollen up and fractured. And the dog comes up, completely non-weight bearing and is in terrible pain. And the sad thing about that is when that happens, not only are they in pain, but most likely it's spread. So anyway, she went and had a little bone biopsy, and she had a little tiny hairline fracture in that little tiny tumor. And within one day, I think we saw the oncologist on a Monday. On Wednesday, she lost her leg. So I called up the surgeon and I said, look, this is what I want to do. I want to leave as much of her femur as possible. I should have said, I want you to keep the plate, because these guys are doing research on the plates to see if that issue in the metal and the breakdown of the metal or any of that stuff is creating these osteosarcs, which I still worry all the time, because she's got one in her other leg still. The one leg she has remaining, she has, and she can't be a bilateral amputee. So I'm just praying that nothing goes wrong there. But I said, I want you to keep as much of her femur as possible, because this is what I want to do. And he's like, okay, it's your dog, and
And what is it that you want to do?
I want to make her a prosthetic leg. I know it's going to be complicated. I know it's going to take a lot of steps, and I knew it was going to take a lot to find someone who was willing to work with me. But I'm the perfect candidate to do that, because I have a rehab clinic. It's my dog. I get it that it may not work. I'm not putting any, high expectations on this to, work the first time, or it may not work at all. And I'm willing to recognize that and be okay with that. But I don't want to not try. It's been a couple months, and I had already done one casting before we went to see him. So, it could be 6 months. And the good thing for Lucy is that she's cancer-free at this point. She just had another CT scan, and we're trying to just keep on it. But, the good thing for her is that knowing that she's cancer-free, she could live another, couple of years to where I have some time. And these guys that are doing these studies actually had sent me a list of sort of you know, kind of these T-pillow dogs when they had their surgery, when the osteosarc was diagnosed, and when they passed away, and why, you know, mets to the lungs or whatever it is. And the timeline's not that long. So she's been around now, Lucy, 6 months already, still cancer-free, as we know, and you know, so I have time to do this with her. And hey, you know what, if it works, great. If it doesn't, it's like back to the drawing board. Let's, you know, maybe there's some other ideas, maybe there's some new technology that's going to come. It happens all the time. The hardest part about this process with Lucy is not necessarily teaching her how to walk on a fake leg, it's getting that thing to stay on. You know, if it's on Lucy and she doesn't want to walk with it, I got to think that it's uncomfortable. That's the only reason. So what am I going to do to make that adjustment? She can't tell me. It's right here. She shouldn't be able to tell me. So, you know, that's the biggest thing, is getting it to fit comfortably and then function. If it functions great but it doesn't feel well on, they're not going to want to use it.